Social care. Many people with a learning disability rely on social care for personal care, to access the community, employment, and to live their lives the way they want. The Care Act, 2014 in England, provides the legislative framework for social care. However, due to chronic underfunding and a high workforce turnover, this is leaving many people with a learning disability with their needs unmet. Many people with a learning disability are forced to pay towards their social care. Between 2021 and 2023, care charges levied against working-age disabled people increased by 66 million as councils attempted to generate more income to offset financial pressures. Many councils have increased charging to the maximum allowed under the minimum income guarantee, which is as little as £87.65 for disabled people between the ages of 18 and 25. These charges mean that people are not being left enough to live on. It is not right that people with a learning disability who cannot work and rely on benefits as their only source of income are charged for accessing social care support. Families pay for their accommodation at home, including food, heating, specialist equipment, and clothing. Social care is a right, not a luxury. Cost of living. Around a third of people with a learning disability live in poverty. Disabled households pay an additional £975 a month to have the same standard of living as households without somebody with a disability. There are few opportunities for people with a learning disability to increase their income through employment, have increased risk of financial exclusion and inadequate levels of benefit. Therefore, they are disproportionately impacted by the cost of living crisis. People with a learning disability have higher utility requirements than non-disabled people. This is through support with electric mobility aids, heating, sensory equipment, lighting, higher hygiene needs, medical equipment, and added cost of 24-hour carers.